Missing teeth can cause a number of different problems, including bite collapse, where patients are losing a dimension that can lead to creasing in the corners of their lips. Or if you're missing a single tooth, you can experience tooth drift into that space that may cause crowding or difficulty in replacing that tooth in the future. So if you're missing a tooth, a lot of times the two main fixed options, or options that'll stay in place that don't come in and out, would be a bridge or dental implant. Advantages to a bridge. Bridges have been used successfully for decades to replace missing teeth if you have a tooth in front and behind of the area that's missing. The advantages to bridges is that you can avoid surgery, but some drawbacks include the inability to floss or easily clean underneath bridges that may trap food, and the inability to floss. And with this challenge comes the risk of possible cavities underneath the bridge. It also, if we're replacing a missing tooth with a bridge, it ties the fate of the two neighboring teeth to support the bridge together. So if there's a problem with one of those teeth, the whole bridge may fail. Now, with dental implants, those are freestanding tooth replacements that are not susceptible to cavities, and if maintained properly over time, can last a very long time and can replace teeth without a natural tooth behind it, and have a number of different attachments for future opportunity in replacing other teeth in the future. So if you're missing a tooth, or if you're wondering what might be specific to your clinical situation, come on in for a consultation. We'd be happy to chat with you about different options that would fit your needs.